honor your time and get started on time with this Estes Chamber Community Forum on our health situation, the pandemic, some of the questions that come up with regard to testing and with regard especially to vaccinations. And I'm really, really pleased to introduce the panel that we have today. But first, just a few housekeeping items. We are going to ask all of the participants to keep your camera off and to stay on mute while we have some of the planned presentations. And then when it comes time for the Q&A, we'll allow you to turn on your camera after you raise your hand to ask a question. And if you want to remain somewhat behind the scenes, you can also just plop your question into the chat. The chat is right in the middle of your lower bar. If you click on that little dialog box, then you can text everybody or you can text just one person as you feel led. I wanted to encourage you to text everybody if you have a question for the panel so that Annika can easily find those questions and bring them to our attention later on. If you do want to ask a private question for one of our speakers, you're welcome to do that. We will share everybody's information in a recap along with a link to the recording of this session so that you can share it with other people. So thanks so much for keeping your video and your sound muted. I want to introduce our speakers, and we are going to actually allow them to provide a short Reader's Digest version of who they are and their interest in being on this panel. Starting with Dr. Erika Norris with UCHealth Timberline Medical Center. I'm really excited to have you on this call. And Dr. Norris, give us a little idea about how long you've been here and what your day-to-day looks like in Estes Park.
Yeah, I'm Erika Norris. I've been in Estes Park for about 13 years, working at UCHealth Primary Care in Estes Park. I'm just rather passionate on this subject of how we can control the pandemic and the role of vaccines. So I'm excited to be here and share some information today.
Thank you. And thanks for reminding me, I had my notes wrong. The rebranding to UCHealth Primary Care Estes Park. Also at UCHealth is nurse practitioner Katie Plassmeyer. Katie, give us a little introduction, please.
Hi, I'm Katie Plassmeyer, and I have been a nurse practitioner here at UCHealth Estes Park Primary Care for the past 6 years. And just in case anybody's confused, we used to be called Timberline, so that's how a lot of people know us here in town. But I live here with my husband and our 2 kids, and we're fairly active out in the community, coach a lot of volleyball, and I have also been very interested. I'm interested and happy to get this pandemic under control. So hopefully this discussion that we have today can help some of that and at least answer some questions that people will have.
Absolutely. You work right on the front lines. I think it's going to be a really great opportunity to find out what questions people are asking. And I guarantee that most people probably share a lot of the same questions. Rounding out our panel, Dr. Robin Zehr, Chief of Staff at Estes Park Health. Dr. Zehr, give us a little idea how long you've been in Estes Park.
Hi, everyone. I'm one of the family docs at Estes Park Health. I've been in town itself for almost 10 years, but working up here for about 6. I'm the new chief of staff at the hospital, so my role will be to kind of help give you guys the hospital perspective of what we're trying to do as we're working through all this pandemic.
It's going to be really useful just to get that perspective. I know we watch hospitalization counts on a daily basis, and there are actually implications. We rely on those case counts and hospitalization counts to govern the Level Up program to determine how many people a restaurant can have in their business. So there are so many implications, both personally and professionally, for the information you guys are going to share today. Really appreciate you giving up some time. We're going to go back to Dr. Norris and hear a little bit about a clinical trial with the vaccine that she participated in, and get a little bit more information on the science behind vaccines, maybe debunk some of the myths that we have. So Dr. Norris?
Yeah, so we all remember not so fondly when the town was evacuated because we were surrounded on 3 sides by fire. And so our family was displaced and roaming the Front Range, staying with family and whatnot. And so I was checking my phone a lot, monitoring the fire, and that's when I noticed that UCHealth was involved with one of the vaccine trials for AstraZeneca, which sadly will probably not be available in the United States until April. But it caught my attention. You know, when the world's out of control, the pandemic, the fires, you just want to do something to make a difference and get back to normal. So I signed up as fast as I could, and it just felt good to contribute because we need tools. Obviously, it's been a rough calendar year. We need tools to bring this pandemic to a close. And I feel that vaccines are a definite part of that. So just a little review of how vaccines work. If we want to avoid being vulnerable to a serious disease, one way we can prepare for that is to expose our bodies to a harmless bit of the germ, either a killed organism or an organism that's been altered so it can't make you sick, or just the proteins from the organism that we're trying not to get sick with. That way our immune system has a chance to say, aha, this is what this bug looks like. And then if we ever meet the germ in person, our immune systems are already prepared for the battle. And we win instead of losing the battle with the disease. So that's a very brief overview. I could go on for a long time about the different kinds of vaccines and how they work, but that's enough. What's unique about these COVID-19 vaccines are that instead of having to purify protein and get a lot of COVID virus, you know, to prepare for a vaccine, which is dangerous for the people preparing it, right? And it's expensive and it takes time. The new vaccines, most of them are based on RNA and DNA technologies. If you've had some biology, you know that DNA, you know, is the information that our bodies use to build the proteins that we're all made out of. We do that by first making a photocopy of the instructions. You can think of the DNA as the instructions for building proteins. RNA as being like a photocopy of a little piece of the book that you need. And these vaccines actually take RNA and DNA, put it into our cells. So we're kind of shortcutting the procedure, just letting our bodies make the spike protein from the coronavirus, so that there's no live virus, there's no infectious organism. It's just protein that's very safe that gives our bodies a clue what the COVID-19 virus looks like. So I think it's an extremely clever shortcut. I used to work in a poliovirus lab doing basic research. So all this sciences are just really fascinating and comfortable to me. So I felt very comfortable being part of this vaccine trial. The Pfizer and Moderna vaccines, which are becoming available in our area, are RNA-based. The AstraZeneca vaccine that I took part in the trial is a DNA vaccine. And then there's also a Johnson & Johnson vaccine that will simply be the spike protein from the coronavirus purified. So they took that other route. So that's a brief overview of how vaccines work, how we hope to prepare our bodies to fight an organism before we actually meet it, and just my comfort level with the science. It's been a very positive experience being part of the AstraZeneca trial, and I do hope that it will become available in the US and just give us more options for curbing the pandemic, as we said, and I'll be happy to take any questions later.
Since you have a few minutes left, Dr. Norris, can you talk a little bit about the options in terms of availability of vaccines?
Mm-hmm. Certainly. So here we are in our little mountain town, and the problem with these RNA vaccines that are already circulating widely are that they must be kept at extremely cold temperatures. And, you know, these vaccines are just not to be wasted. And so far it's pretty difficult for us to get vaccine here in our community. Someday that will change. UCHealth strategy has been, if you're on the portal with us, they're sending out invitations for people to drive to Loveland or one of the Valley locations. to receive vaccine. I'm sure the hospital will be getting vaccine at some point, but that hasn't come together, is my understanding. Robin can comment on that later. Salud also, some of our friends and neighbors have gotten vaccine from Salud. They are doing their very best to help with this public health crisis, but they have very, very limited vaccine. So don't call Salud, but you can watch their website. As vaccine becomes more available, they will also try to help people get signed up to get vaccine from them, but it has to be from their webpage. Does that answer the question?
Yeah,
you think,
I think
Donna?
that's a really good beginning, and we might hit that back in the Q&A session. I want to just synapse over to Katie Plassmeyer, who's a nurse practitioner. We had agreed in our pre-meeting that Dr. Norris would give an overview of the science and her experience in a trial with the vaccine. Katie sees people on a regular basis, both through telemedicine and through in-office visits. Katie, can you give us an overview of the client experience right now and the questions that you're hearing the most from your patients?
Yeah, so I'm sure almost everybody on this webinar right now has experienced trying to seek some type of healthcare over the past few months or several months. And there are some roadblocks that come with that. So at least at Timberline or UCHealth Primary Care in Estes Park, we are doing lots of telephone triage. I answer a lot of phone calls or take a lot of phone calls every day, answering people's questions about COVID or triaging their symptoms. We have a bunch of nurses that will answer the phone too, not necessarily that are here in Estes Park, but and answer questions that have to do with symptoms and send them along to us if we need to talk to them. And a lot of people can be directed which direction they need to go from that. We are also, if anyone is sick, we can see them for telehealth visits and have been seeing a lot of people for telehealth visits to help direct their care. And a lot of things can be accomplished via telehealth. I know a lot of people maybe have some reservations about seeing your healthcare provider virtually, but a lot of things can actually be done very efficiently that way. And right now, while we're facing a global pandemic and we're trying to keep people healthy and trying to keep sick people away from healthy people, including healthcare providers and other staff, it has been a great tool for us to use, and it works pretty well most of the time, to be able to discuss people's symptoms and then get them to the correct place to get care. And then, in times where people either don't have access to a computer or a smartphone or something like that, where they can do a telehealth visit, we will often just have people come to the clinic, but they stay out in their car, and then we go talk to them from their car, and if that means one of us has to get all gowned up in all of our protective equipment, then that's what we do, to try to get the best assessment and send the person to the place they need to go. But other than that, for normal healthcare needs, people can come into the various clinics in Estes Park, and we're happy to see people and know that all the healthcare facilities are safe places to be, because we're not commingling sick people and healthy people at this time, because no matter what the illness might be, because there are other illnesses still that we see that are not COVID. That's another important thing to remember. Right now, we're all hyper focused on that, but we want people to get the care that they need to get when they need to get it. So there are options out there, and everybody is ready to help.
It's a really good perspective, Katie, since a lot of people are so focused on whether they should visit the doctor when they have symptoms. Since you have a good bit of time left here on your 10 minutes, I just wanted to ask you to address when should they give you a call versus when should they go ahead and come in?
Yeah, so I think right now, in any situation where there's any kind of illness type symptom, it's really good to give us a call so that we can sort of triage the situation, so that then when you show up at the clinic, there's not any hesitation about what needs to happen, because it's already been discussed. But the other important thing to remember too is you can show up at the clinic and then call us while you're sitting out in your car And we're happy to triage the situation at that time too. And sometimes that is, that has been the way that some people have found is just easier to get to who they need to talk to. And we're happy to do it either way. So but it is probably best to call ahead of time, or at least notify us ahead of time, so that plans can be made to make sure that we are doing things appropriately and sending people to the place they need to be.
Right, and saving time for people who
Yes.
need to reserve that time for other uses. So the purpose of coming to the clinic and then calling from the car would be just to kind of get in line to be seen. And then
Yeah, I mean, really, we take walk-in patients all the time. So that's kind of how we have been asking people, if you need to come in as a walk-in and you don't have an appointment, that's totally still fine. We just ask that people call, and there's a big sign on the front door that just asks that people call before they come into the clinic, so we can just know what the situation is and if we need to be taking extra precautions before we have contact with that person.
Good, good. Okay, very good. Well, I'm gonna, we have some really good questions to ask, and I want to be able to get responses from all three. So I'm gonna allow Dr. Zehr to give us same kind of perspective on the experience at the hospital, how you are instructing and encouraging your staff right now, and when people should know when they need to go to the hospital. How do we make that determination? Dr.
Sure.
Zehr?
I think it's important to point out that, we've all learned and we've grown so much throughout this whole time frame. Comparably to where we were a year ago to now, it's changing. And I'm sure for all you business owners and everyone, you have to keep up with all these guidelines just as much as we do. So the information I give you today could be very different tomorrow. But that's kind of what we've tried to do throughout this time. When the pandemic first broke, just like with everywhere, everything shut down, and we had to figure out how to manage patients and how to appropriately treat everyone, and knowing our limitations in Estes. We're a small hospital. We do not have an ICU. And when you heard the horror stories of what was happening everywhere, we had to kind of prepare for what to do. So it's nice that we've kind of transitioned now to having a better understanding of COVID and what that means and all the different variances that happens, and giving us an ability to better treat it. So like Katie said, similar for us, we are doing I think the telehealth and the triaging and trying to get people tested is the most important thing that we're doing right now. A lot of it is contacts, exposures, I need to travel, those sort of things are reasons people call, and we can get you kind of triage through for testing. What has shifted is, how do you know how sick you are? And that's a hard question for some patients to understand. Just like with any flu or any virus, it hits everyone differently. And so someone might have a mild case and someone gets more extreme. And I think the biggest thing to remember is if the classic symptoms of COVID are fever, cough, shortness of breath, and then there's this huge variance of random other things, headache, diarrhea, all sorts of other things. So if any of your symptom is extreme, if you are feeling short of breath, you can't talk, if you're more confused, if you're having any symptom that seems out of the ordinary, that's an emergency. If you even have that sensation that something's different, that's something you should go and see for. If it's daytime hours and you feel comfortable calling your primary care first, great. We would love to triage you that way. But, you'll never be turned away from an emergency room, but we want to keep the emergency room for emergencies. The other side of that we've seen happen is people are afraid to go to the emergency room for other things. People still are having heart attacks and still are having strokes, abdominal pain issues. We're open, we're ready, we're trying our best to keep everyone safe for everything. So it's important to know, if it's a mild symptom and a little fever, you can probably talk to your primary care doc. But if you are struggling to breathe, do not wait. come in, right? The other side of it is the hospital has somewhat shifted in our ability to care for COVID patients in the last few months as well. Initially, we were kind of sending everyone down to a bigger facility where they had more treatment options. Thankfully, we are now have the ability to keep patients in Estes. We have rooms that are negative pressure that keep, try to keep the germs where they are and allow us to be as safe as we can to take care of you. But we also have the medicines that potentially we can do to help. Now, those medicines are limited and we only have a few of them. So if someone is truly sick and truly progressing, we would still need to transfer. We still do not have an ICU. So if anyone needs higher level care than what we can provide with just routine oxygen, that person, we wouldn't be able to take care of them safely here in Estes. But those are the biggest things that I would say. A lot of people have a sense of this seems extreme, and that sense is real. And that's when you should go get care.
It's really good. And just, it's my job to answer the stupid questions that people might have as well. The negative pressure room, does that mean that
Sure.
the germs that you might just breathe in and out won't go through the ventilation system in the hospital?
Exactly. So we always have had a room like that in the emergency department. And what we've done throughout the pandemic is gotten a few more in the emergency department and made some on the hospital floors themselves. So if you were sick with an appendicitis and you were on the hospital floor, you wouldn't be getting the same germs per se than someone down the hall that might have COVID.
And some of us have seen movies where they show how everybody's breath gets into the air conditioning system. So I think it's really good to know that, because I would hate for somebody to not get the right care that they need because they're afraid that they might get sick at the hospital. You take precautions to make sure that that doesn't happen. It's important to know. Well, thank you very much, Dr. Zehr, for that overview. And I'm going to use that as a springboard into our Q&A. Now that we have kind of an overview of your different scenarios, some of the things that we're hearing the most questions about before we get into the vaccine itself have to do with misconceptions about when to get tested. And as you mentioned, Dr. Zehr, there's a very real need for people who do need to travel to get tested just so that they can have a negative test to land in another city or another state. And that requirement should also be a flag to ask the question, should I be traveling right now? Do I need to be traveling right now? And I know that it has come up in different scenarios. Most of the testing that we see advertised is if you are symptomatic. But I'll throw out there, if people want to be tested in order to be able to say, I have a negative test here to show you that I'm okay to be in this forum or to travel on this trip, tell us what the reality is in that scenario.
So I think it's important to point out that a negative test today could be a positive test tomorrow. And that's the unfortunate reality of COVID, is it's such a long incubation period that having a negative test, even if it's a requirement, doesn't mean you're truly negative. So you still need to always remember the social distancing, the mask wearing, all those precautions for everything. There's no really true safe way to do it. Obviously we want to prioritize testing symptomatic people to make sure we're monitoring all of that. But if you have a need and we need to travel, people need to visit their family. There's things that come up, emergencies everywhere, right? So, to have that safeguard is okay. The other side of it is insurances, we love health insurance, they don't always want to cover a test for something like that. And then it might be you will have to be willing to pay for that test. It's kind of that hard sense with this pandemic and this rolling coverage of everything. We don't know what will be covered for you. And so if you want to test for travel or reassurance, I can't always say that that will be a benefit for you. But it's something that if you're willing to have that, that's great. And we'll try to expedite and get that ordered for you.
It makes sense that even if you have a negative test when you get on a plane, by the time you get to your destination, you may have been exposed. So it's a false sense of confidence. Dr. Norris, I know you had some perspectives on misconceptions with regard to testing.
Yeah, I think often what we see is that someone in the household or at work has tested positive, so everyone around them instantly gets tested the next day. And that can result also in a false negative situation because it takes, maybe 5-7 days before a test will become positive after an exposure. And so it's not that we should give up on testing or feel that it's hopeless. It's just that we have to grapple with these facts, but we're all available for that. I know, all the providers in our clinic and at UCHealth are eager to talk to people about their negative or positive test result and what it means in their situation. But I think, yes, what you ladies have been pointing out is very valuable, that you can't just say negative test, I'm good. There may be more to the story.
And you hit a really important point that those symptoms may not show up for 7 to 10 days. And just as that the accuracy of the test may not show up for 7 to 10 days. So if you've been living in a household with other people for those 7 to 10 days, what's the likelihood that that unknown exposure to them has already passed the virus along?
So I can jump in here. So really we are, what we have been talking to people about and recommending is if you live in a household with someone who has tested positive, really to be safe across the board, that entire household needs to pretend like they have COVID. It does not necessarily mean that everyone in the household has to get tested. There are some instances where, it is important. It's just it's a case-by-case instance, depending on who needs to be tested or how we decide who needs to be tested. And if there are strong feelings one way or another, we're happy to help accommodate those kinds of things. But really, the bottom line is that if someone in the household tests positive, that whole household really has to assume that they have been directly exposed and or are positive already, Yeah. So, and that really it presents a lot of difficulties for people and a lot of logistical nightmares for people. But those are also the types of things that we're happy to help discuss and try to figure out, what's the best course of action here and all those kinds of things.
Right. There's a level of disappointment, canceling trips, canceling work appointments, but it's worth it to stay quarantined for the entire time. Good. Katie, you speak with clients through telemedicine. You often man those phones before they come into the office. What are some of the questions that you receive about whether I need to be tested?
So a lot of people will just tell us their symptoms and say, I don't know if I should be tested or not. And if I'm being 100% honest, a lot of the time right now, when people have these random symptoms that maybe fall into the category of that it could be COVID, a lot of times we are testing people just because we see a huge range of presentation for this. Some people are very typical, and you talk to the person on the phone or you look at them sitting in their car and you're like, that person's going to have COVID. Like, you just can kind of tell what the situation's going to be. We still get those people tested, even if we're pretty sure. But so I mean, a lot of times with these strange symptoms that people are coming up with, we will talk that through with them and just get that test ordered for them. And we have been seeing a lot of positives. When this all first started, we were all sure we were going to find a COVID case, and think everyone thought that they had COVID because it was just it was the big thing going on. As it has progressed, we are seeing more and more and more and more COVID cases because it's just more widespread now. So it's become increasingly common that those tests that we think are going to be positive do come back positive. So whereas at the beginning, back in March, April, May, we really weren't seeing that much of it up here in Estes Park, whereas other places were seeing a lot of it. But that has definitely changed now.
Right. Yeah, you bring up a really good point about how symptoms really differ. And I'd like to hear from all three of you about why you think it is that some people are nearly asymptomatic, even if they have tested positive, and others get really, really sick. What causes the difference in their reaction?
I think we don't know yet. I find myself saying increasingly frequently to patients, they're still writing the textbooks on this one. You know, we really, sometimes I feel like, wow, maybe I've got a little insight on what's going to show up in the textbooks from our increasing experiences, unfortunately, with our patients with COVID. But I feel like we don't understand. It's possible that people with better vitamin D levels don't get quite as sick. It'll be interesting to see how that pans out. And there's even some genetic factors they're studying. Some people handle COVID better because they have a different set of genes. The jury is out, but it'll be so interesting to read the books in a couple of years.
I'm glad, Dr. Norris, that you mentioned vitamin D, because on that note, I've heard from some that you should take at least 5,000 IU a day, and some say 10,000 IU, and it's an incredible amount of vitamin D to take. What would a reasonable recommendation be?
Yeah, normally I tell my patients, you know, just for their bone health to take 1,000 or 2,000 international units a day. And I've told people, yep, double it up. 4,000 or 5,000 international units of vitamin D is not going to hurt you for a couple of months. And I do think things will settle down in the near future, not near, sadly, but 6-8 months because of vaccination, things should be vastly different. But for now, take your vitamin D.
Mm-hmm. Good. Dr. Zehr, what about from a hospital experience? Do you often see a wide range of responses to the virus?
Yeah, obviously we've had our share of outbreaks through the hospital, as well as the community. And there's nothing that you can pinpoint to. It could be a very healthy person who has a very severe response. Obviously, we know that age has something to do with how people respond to the disease. But it's very interesting to see who has the severe, but not only the severe response, I've also seen prolonged course afterwards. And that's sometimes more in the ones you wouldn't anticipate. The otherwise healthy who had a minimal response to COVID, but they just are taking a long time to get back to their previous baseline. And so it'd be great if we knew why and if we could help them through that. But really at this point, we're learning just as they are. And so there's not a huge amount of things we can offer except working through everything and making sure we're not missing other causes.
That's a really good point. I love that you point out, both of you, that the textbook is still being written, and it's important that we pay attention to all the different factors that indicate different responses. Medicine is a practice, and I appreciate the level of care that our practitioners take to just pay attention to what's been happening and use that as a rationale for moving forward. I think it's a good time to answer this one question in a chat. I'm not going to always respond to the chat right away, but it's relative to the question that I just asked about negative testing. So what is the reason for quarantining after a negative test? As an example, I have a friend that was exposed to a person who was then diagnosed. She got tested 5 days after exposure, even though she had no symptoms. The test came back negative, but my friend was still told she needed to quarantine for 10 days.
So the quarantine rules have changed throughout this whole thing. But the reality is the gold standard is still 2 weeks. because there's still a percentage of people who can develop symptoms after that 7-day, 10-day mark. For this person, her test was at 5 days, which isn't even the 7-day test to see if you can break free from quarantine. So her test was a little early. And so even despite a negative test, I would have told that patient the same thing, 10 days, you have to kind of watch that. So the previous quarantine rules were 14 days from exposure, from the last contact with the exposure. Mm-hmm. So if you live in a house with someone and you have to take care of this 3-year-old child who has positive COVID, your 14-day quarantine doesn't start till their 10-day sickness is over, so that's 24 days of isolation and quarantine. Yeah. To test out is what the CDC kind of came through with some alternatives, because we know it's hard and we know it's a lot to ask for families and employees and everyone. It was the 7-day test or 10-day monitor symptoms. So this person kind of fell out of both of those, and that's why it was probably recommended the 10-day monitor symptoms.
Right. It's a really good point that you made. If you're caring for somebody with COVID, your quarantine begins on the last day that they present symptoms because of your exposure. Right.
Right. It's, based on when they're considered clear, 10 days from their positive or their start of symptoms with symptoms improving. Right. Then yours would start.
Yeah. And I wanted to just chime in here too, because there really is a difference between the terms quarantine and isolation also. Mm-hmm. So isolation is when your COVID test is positive and you should be literally isolating yourself in, if it's possible, obviously, not always possible, in a specific room or wherever area of your house where other people are not. And that is obviously very difficult for a lot of people, especially moms trying to take care of kids. And I mean, many situations. And sometimes that's just not possible. Quarantine really means that you were exposed and you're sort of waiting it out. It's that waiting it out period where you need to remain at home, quarantine, so not be around a lot of any other people if you can help it, besides contacts within your own household. But anyway, those are just kind of I just wanted to bring up the differences between the terms isolation and quarantine, because those two terms, and they do get used interchangeably a lot, which is fine. It's just, but when you hear those two different terms, that's what those mean.
Thank you for the distinction. It really does help, Katie, to have that distinction. In the case that the question that I asked earlier about if one person is exposed but doesn't know for 10 days, then do you still recommend to isolate that person, or do you presume that everybody has already been exposed in that 10 days? And I think that's a decision that probably every household would have to make on their own. Dr. Norris, any comments with regard to testing that we've missed or on quarantining?
I had a thought a second ago, but it escaped me. I'll raise my hand if I think of it.
Good. Well, then we can always bring back questions about testing as we move on, but we are here to talk about the vaccine. And Dr. Norris, thank you for sharing your experience in that one test. And it's really helpful to know the science behind the vaccines and how they differ and why some require the extreme cold storage and others do not. It doesn't mean it's less effective. It means it's a different approach to the science. What are some other common questions and misunderstandings about the rollout of the vaccine? And I'm going to take this back to Katie, because you are, taking those telemedicine calls on the front line. What are the kinds of questions that you're hearing?
So a lot of the questions that we're hearing so far about the vaccine are just, how can I get the vaccine? And we kind of talked a little bit about the various options here in Estes Park, or, lack thereof of options locally in Estes Park. But it does look like a lot of people are asking questions in the chat about the vaccine. I don't know if we want to take some of those or.
Yeah, I want to give each one of you a chance to speak into the general misconceptions that you're hearing, but then I'm going to move to the next question from Greg if you don't have any other comments.
Yeah. Yep, I think that's good. Because I think we're going to answer all these questions here
in your responses. So
yeah.
Greg Muhonan asked, help the group understand the efficacy of the vaccine. What percentage of COVID vaccine recipients will or will not contract coronavirus after taking the vaccine? And why take 2 doses instead of 1?
Yeah, this is a fantastic fact that the Pfizer and Moderna vaccines have incredible numbers. You know, we're talking 95% efficacy. You know, most of us appreciate the flu vaccine because influenza can be a terrible illness, but the flu mutates so quickly that we have to develop a new formulation every year. You know, we watch it sweep around the world and see what's mutated and prepare a vaccine to try to hit it the best we can. But I just did a quick search, and the flu vaccine ranges from 20% to 70% efficacy. That's a huge range. You just don't know how it's going to go. But these vaccines, because they're targeted to the spike protein, which is a stable part of the virus, you know, we hear about these new variants and mutations, but it would take a whole lot of mutation for these vaccines to not work against the spike protein. So 95% is amazing. And, you know, some of the numbers that are out there is like the Moderna trial, amongst all the people that received, or amongst all the people who participated in the trial, there were 95 cases of COVID. 90 were in the group that didn't get vaccine. 5 were in the group that did get vaccine. And of those, they didn't get very sick. They just had a positive test. There were no critically ill people. So this is like amazing and fantastic. I'm not sure what the Johnson & Johnson vaccine data is going to look like. AstraZeneca, the trial I'm part of, I think they released some data too early and it was a little confusing, but hopefully it will also be very effective. And it's nice because it's not cold sensitive. It's kept at refrigerator temperature. It's very, very cheap. It's going to be awesome for third world countries and hopefully helpful in America as well. One thing I want to get out there is, as we said, the textbooks are still being written. We don't know how long these vaccines are effective. It's still worth doing because we're in a bad spot. We need business to open up downtown. We need the economy, you know, to be revived clearly. And we need to not be losing so many citizens to this disease. But in all honesty, there's not been enough time to study how long these vaccines work. So it may be like flu that we have to get it every year, or it may be that, you know, 1 or 2 doses sets you up for quite a while. Well, you know, we'll watch the news.
Dr. Zehr, do you have any comments on the percentage of?
No, I think Erika did a great job with that one. The other thing that we don't fully know with the vaccines, more to come, is could the person who have had a vaccine potentially not get sick but spread it to someone else? And so that's another area where until we have more data, and that's part of why we're looking at masks and social distancing for a long time after, even though when people are getting vaccinated, because we don't know if me being fully vaccinated, if I could potentially still spread something to you. And so that's something that we all need to keep in mind too.
That's a really good point, because you don't know, even though the CDC says you could safely return to work if you've been symptom-free for at least 10 days.
Yes.
Yeah.
And it's not symptom free, it's symptom improving.
Oh, right, but
yeah.
without the use of medication that you're.
And
yes.
no fever free for sure.
Fever free is really the symptom that indicates that your virus is still alive.
But I think it's also important to say though, with that whole, you know, we don't know if people who are fully vaccinated can pass the virus on to other people. Things like that are being studied and worked on right now. So they are really doing their best to try to figure out the answers to all these questions so that eventually, hopefully soon, in quotation marks, we will know the answers to those questions and be able to just say to people, yep, this is what we found, you know? And so it's coming. It's just, we're taking this one step at a time right now.
Yeah. Well, we have to be patient and we have to continue to hold the front on all the safety measures until we have answers to those questions. Doug asks, if exposure risk is low, should we wait for the AstraZeneca vaccine or other vaccines because they're more advantageous? And Doug, you might want to unmute and explain what you mean by exposure risk being low. Does that mean that you're staying isolated and that your risk of exposure is low?
I feel like I could comment to that unless the gentleman wants to get on. Are you there, sir? Okay, yes. So we do have patients who say, I'm on the UCHealth portal, I got an invitation, I can't get to the Valley. I don't have a ride, I'm not physically able, and they feel kind of distressed and left out. I think there's lots of room to say, we all have to be careful, masks and distancing, like Robin was reiterating. Nothing's going to change too quickly. We all need to be cautious. And so it is possible that a more stable vaccine might get to Estes, eventually, but those have to be people who are willing to stay home, be super careful. And I feel like maybe that's what the gentleman was alluding to. But by all means, obviously I'm an advocate, we all are. If people are willing to get vaccine and they get an invitation, they should grab it, whether it's through the health department, UCHealth, the hospital's path that comes together later. If we have 75% herd immunity, so that means some people are getting antibodies because they had the disease, some people are getting antibodies because they have the vaccine. If we get us all to the 75% mark, things can loosen up and get a little closer to normal. So I think we're all advocates of get what you can get, but yeah, more paths will open up over the coming month or two.
Good. Doug, I heard that
my question is really, is there any just clear advantageous benefit or superiority among the vaccines that we know about at this point that would lead to waiting if one's exposure risk that is relatively isolated and so on? If we can wait safely, should we? Because there are better things coming than the first tier.
Nope. I feel like AstraZeneca's numbers so far are not as good as Pfizer and Moderna. And it's, because I'm part of that trial, it's hard not to be, like rah. I want to see this succeed. But the fact is there's vaccine available with incredible statistics. And I would advocate for just taking whatever comes up as available next and not waiting for the future.
Good point. Rick Life, an officer in Estes Park, mentioned that he's been hearing a lot of fear from people about side effects after getting the vaccine. He did experience some soreness at injection site and felt tired for a few days. And someone he knows had a slight fever, but Tylenol took care of it. So what's a way to assuage the fear of people who are afraid of the side effects?
So I'm happy to talk about this one. So yes, so very common side effects would be soreness at the injection site, feeling tired the next day, which is actually a really good thing. Maybe some people will get a low-grade temperature. Some people may get what may be considered more than a low-grade temperature, but that would probably be fairly rare. And just feeling achy and kind of crummy the next day. And really, what I have to tell those people is a lot of healthcare workers who have been immunized so far have experienced a lot of those things, and somewhat more after the second vaccine was given. So when you get your booster shot. But really, those things all went away within the first 12 to 24 hours after the symptoms started. It didn't last much longer than that. and some ibuprofen or Tylenol took care of it in almost all cases. And of course, there are going to be extreme cases. There are always outliers in every situation. But so far, at least at UCHealth Estes Park Primary Care, we have not heard of any very serious vaccine reactions or anything like that. And really, I've tried to encourage, all my coworkers and anyone else that I heard having some side effects last week after they got their second vaccine. It's like, this is a good thing. We should all be happy that our bodies are doing what they're supposed to do. This is your body's reaction. Your immune system is doing what it's supposed to do. And really, like, as my body was kind of achy last week, I was like, yes, I'm so happy about this. Because I knew that I was mounting the response needed to fight this virus if I ever come into contact with it.
Good point. Yeah, thanks for elaborating on that. Caltha Crow asked if there are places in the valley where the vaccine is available, and I think it might be good for us to just reiterate after the meeting the places where the vaccine is currently available if somebody wanted to pursue that. Does anyone want to comment on availability at this point?
So I can make a comment. Obviously, being in a small town, being in Estes, we're a little bit more isolated as far as the state rollout of vaccine goes. I want everyone to know that the hospital and all the clinics are doing everything we can to try to get the vaccine. When the announcement shifted that 1B is now basically half of our population of Estes Park, that's very exciting. No one's more excited to get you guys vaccinated than we probably are. It's just a matter of maybe that announcement was a little too soon before everything was in place to provide for you. We are kind of at the Estes Park Health itself is at the state and the county. We are trying to get what we can from them. The bigger facilities like UCHealth are getting it on their own, and they're then sharing it with who's appropriate for it. And so I think that's the big thing, is that for our residents, the best thing to do is to go to the Larimer County site about COVID and the vaccine. And there's a form that you can fill out that prioritizes you which category you would belong in. That queue then will be a distribution way. And so they'll take those names that come through and then try to find the proper place for you to go to get that vaccine. The goal will be for Estes to have it and for us to provide it to you, but it may take more time to get that going. Right now, I know that UCHealth is providing, but it's kind of a random lottery. It's a check your portal, get your message, schedule something. Salud has some, again, through more of a different realm. So it's not that we have it and we're hiding it from you. We are trying to get it to provide it to you. And so being aware of all those options is important. But the struggles are the same if you live in Fort Collins, if you live in Denver, if you live in California or Florida. The struggles are the same. More people need the vaccine than what we have available to give to people right now.
So, and also just another quick add-on to that. To our knowledge, there is not a place that you can drive to down in the valley and get in a line and get your vaccine. I saw on the news this morning that I think maybe it was the Pueblo Health Department, basically set up a drive-through thing where people could just come and get their vaccine, but they only had 700 doses to give out. And I'm sure way more than 700 people showed up for that. But there is nothing like that going on to our knowledge right now. I think the best things to do, so down in the valley, UCHealth is sending out invitations through My Health Connection. And I think it's important to note, because I've had a couple of patients message me about this, that they think that you have to check your portal to get the vaccine invite, and you will get a notification to your email usually saying that it will usually say something like, you have a new message in your My Health Connection account. And it is just an email that comes from My Health Connection, but it should go to whatever email address you're attached to, okay? And that would be if you are a patient of any UC Health clinic, whether it's a specialist or primary care. All of those patients are included in those vaccine invites or in those groups, whoever's eligible for it. But yeah, so right now there's not a place to just go sign up and line up for the vaccine, at least not in Northern Colorado to our knowledge. But things are changing probably on a daily basis. So things like that may become available tomorrow or by Friday. We just don't know.
And I think Ms. Crow's question was, how about outside of Estes? Robin, do you know the county website? People can just go and sign up like you're saying and possibly get a destination in the Valley.
The sign up is more just to be added to the list of who needs the vaccine. It's not to be signed up to get it or, to sign up for a time slot. So yeah, there is no place right now where I think you can just call and schedule an appointment.
Can you comment on who is deciding who gets the vaccine and how that's determined? I know it started with first responders and hospital workers. Can you kind of give an overview of how that's going to widen to include other populations?
Do you want me to comment on who's making those decisions or how the decisions are?
And how should we, just be prepared to expect when we might get in line?
So again, the county and the state have a great kind of thing on their website as who's qualifies into these categories. And some of it's a little gray. So 1A was the high risk medical workers, the ones who are seeing patients and around it. And then 1B is very broad. It's 70 and over residents, it's essential workers, it's less risky healthcare workers. And that expectation is hopefully to get those people vaccinated January, February, even into March. And then kind of springtime rolls in the next set of people. Those with more, maybe younger, but higher health risks, other essential workers. And then basically by summer will be adults or kids 16 and over who haven't fallen in a category yet. But again, that will probably change. 1B was started out as something and became something different overnight. So my guess is by the time we reach February, it's going to look different.
Because we keep moving. How do you currently show that you have had a vaccination? What's the best way is there a card that people get?
Yeah, so when you go to get the vaccine, so I can only obviously comment through UC Health. When all the healthcare workers were able to go get their vaccines, you get just an immunization card that looks very similar to the longer fold up immunization cards that little babies get when they're born. Yeah. But it looks just like that, except it's just only for the COVID vaccine. And then also most healthcare entities now have an online portal that all of your information gets stored in. So that's the other way, is that it's, like my Health Connection account through UC Health has my vaccine information stored in there also. So there's an electronic version and there is a card that everyone is given that says, which vaccine it was, when it was given, and the lot number, all the information about the vaccine.
Mm-hmm. But even if someone is vaccinated, they still need to continue to wear the mask, wash hands.
Absolutely, yes.
Practice social distancing.
Yeah.
And I know the burning question is, when will we be able to take the masks off? And I think the answer is already clear, that nobody knows, because the textbook is being written on this. Would you agree?
Yes, I'm starting to get those questions. When can I visit my grandchildren and under what circumstances? And, after the first dose, and somebody had a question about why 2 doses, different vaccines are designed differently and they're tested differently. And, if something got approved by the FDA with 2 doses, you have to do the 2 doses. That's the data that we have about the medication or vaccine is based on how it was tested. So some vaccines like Johnson & Johnson, the protein-based immunization that might be out next month, is a single dose. Interesting. But the RNA and DNA vaccines so far are getting approved for 2 doses sometime apart. So after your first dose, you maybe have 50% immunity after 2 weeks, but you really need that second dose to get up to that absolutely incredible 95% effectiveness. And so things are always improving, but we do have to keep watching the recommendations from the CDC. Like Katie said, everybody's aggressively collecting data and information so that they can give sensible recommendations for when we can visit without masks or, begin to meet in closed spaces again.
Mm-hmm. Yeah, good words. This is related to what Mary asked, if you can tell if somebody has had the virus and recovered up to a year later. There's different schools of thought over the antibodies and whether someone who has recovered from COVID still needs the vaccine or not. What would you say to them? Robin?
Sure. I think the reality is we don't know how long immunity lasts. We also know people can get reinfected once they've already had COVID. And, there's many kind of, is it this long? Is it this long? What is that perfect protection coverage? And we don't know. So if you've had COVID, yes, get a vaccine. If you haven't had COVID, please get a vaccine. I think that's the bottom line is that's one way that we are watching immunity. And we'll know then that, we all need to get a booster for COVID every year or every 5 years or never at all. But those who haven't had that vaccine, we wouldn't know how to help them as far as protect them for later.
Yeah, and I can also say from a personal experience with a family member is that there are people and doctors out there doing studies of patients trying to figure out how long antibodies are present. And if that's all just being figured out. Again, like Dr. Norris said earlier, the textbooks are being written and hopefully in a couple of years, sorry about that, we will look back on this and have so much information going forward, but we just don't have that right now.
True. Good to remember that. Somebody was mentioning, T. Brown mentioned long-term symptoms even after recovering from that initial.
What?
She went to the next question.
Yeah, it's okay.
Oh, Mary, did you want to make a comment about your question? Did we need to dig into that a little bit more?
Did it answer?
Yes. My question was, can I be tested to know if I had the vaccine or had the virus and recovered from it? Can you tell if I had it or not? Not whether to take the vaccine. We're all going to take the vaccine. But I want to know if I could be tested to see if I had it or not. If I don't have it now, will it still show up?
Okay.
Right. When you deal with an illness, your body, when you deal with an illness and you win, you prevail, your immune system has made antibodies to the offending germ. So people can be tested for antibody levels and see if they have antibodies against the virus. However, unclear if insurance will pay for it. It's about $100. And what I tell people is it is entirely unclear what to do with the information because we're still going to recommend the vaccine. And we don't know how long those antibodies protect people. So it's a very interesting question. I have had patients want antibody tests just out of curiosity, and I really wanted to see the answer too, but it sort of falls in that curiosity category because it doesn't tell anybody how to live differently.
But
No,
and the other part to that too is that if you come back negative for those antibodies, that do we really know if does that mean that you didn't have COVID 1 year ago? We don't know the answer to that right now. So we don't know how long the antibodies last. I guess that was the point of my comment earlier, and I wasn't very clear about my answer. But so yes, you can get an antibody test, but if it comes up negative, that doesn't mean that you didn't necessarily have it if your symptoms were way back a year ago. You just might not have enough antibody showing up still in your blood sample.
Thank you.
all right. Thank you. I've recovered. I'm fine, but I want to know if the flu or virus or whatever it was I had a year ago was the COVID virus. I just wanted to know if you could tell. That's all.
Thank you.
Yeah, you could talk to your provider about the benefits or lack of information perhaps that a test would show, but you could discuss that with your doc.
All right. Thank you very much.
Yeah, thanks very much. So we were back to the fact that some of the vaccines require a second dose. T. Brown asked if that second dose is unavailable at the recommended time and you have to wait to get that second dose, will it be just as effective?
From my understanding, the way they're offering the appointments for vaccines and the scheduling is those people all have an automatic second dose available as long as they can come back the day they're supposed to come back. So as of now, the way that it's been rolled out is to ensure everyone has both their doses rather than giving everyone the first dose and not knowing about giving them their second dose. Correct me if I'm wrong, though.
That is absolutely the way that it's supposed to happen. If it did happen a different way, as the person's question in the chat, and the person really couldn't get their second dose, then that's not the way that it's supposed to work. I mean, all we can say is that, you know, at least with UCHealth's rollout, the first dose and the second dose are all scheduled at the exact, you know, they're scheduled on the same day for 3 weeks apart, or however long the interval is for your particular vaccine. And that should guarantee that you have the second dose available to you when it's your turn, when your second appointment comes around. So if that did happen for somebody, it was either a mistake or who knows what the situation was, but that's not the way it's supposed to work.
Yeah, I don't know if probably all the viewers have noticed we are not living in a perfect universe, and it is possible for things like that to happen because everybody's doing their darndest, you know, doing their very best to keep things organized and fluid and keep people informed, but it's all happening so fast and it's so urgent that there are going to be flukes that occur like that. But, you know, with all the vaccine schedules for other types of vaccines, it's very clear, you know, if you miss a dose, just get it as soon as you can. And biologically, it makes sense to me. There would be a very reasonable result. So I don't think that's a reason for fear, you know, like if the second dose is going to be delayed by a week or a month, so be it. I would still get it.
Good to know. We don't have any other questions in the chat, but I just want to remind you that if you would like to speak up and ask a question to either of the three panelists, just you can raise your hand so that we can recognize you. There's a little button called reactions that if you click on the little smiley face with the plus sign, there's a little button that says raise hand, and that would help Annika to see that you'd like to speak. So feel free and use that if you have another question. I'm looking back at the questions that we had planned to address, and I think we really have addressed all but one. And it could be a wild card, but you know, we're talking about just like the the vaccination card that you get from your COVID vaccine is just like a child would get from getting their childhood vaccinations. And that reminds me that there is a whole group of citizens who just really don't want to comply. They don't want to get vaccinations. And there's a range of reasons why. And I wonder what you would say to those who typically would just not want to take part in any kind of vaccination. What's your answer to those people?
I'm just a big advocate of communication and education, and just trying to keep the lines of discussion open. If my patients say there's no way I'm going to get the vaccine, I'm not going to judge them. Nothing, like nothing terrible is going to happen from the government, I don't believe. I just ask, can you tell me why that is? And try to just discuss, because sometimes people have very valid concerns that can be answered. And sometimes it's just their personal choice not to get the vaccine. And like we said, all we need is 75% immunity around us, and life can be more normal. And that can happen a variety of ways. And some people just choose to be careful and not get immunized.
Good point. Katie, what are you hearing in your practice?
Yeah, I would say the same thing. I mean, I think it's just important to respect individuals' opinions, because I'm never going to force someone or try to coerce someone into doing anything. It has to be your own choice. And but again, education is the most important part of what healthcare providers do almost in all cases. Most of the time things can be worked out and questions can be answered just with listening and hearing what someone's concerns might be, and trying to address those concerns as best as possible. But then in the end, it's their own choice. So I might give my opinion and make recommendations, or try to be as persuasive as I can be, but it's the patient's choice. So
Thank you. Maybe Dr. Zehr, did you
Yeah, no, I agree with everything that's been said. The other side of it is, as this is rolling out, it's that balance of, I've had a lot of people say they want to wait. They want to see how people do. They want to they live a pretty isolated life anyway. They're okay waiting. And that's reasonable approach, as long as they understand their risk of waiting. Ideally, if they waited, maybe there would be more vaccine available and it's not going to be a big issue moving forward, but maybe not. And maybe they missed their spot for getting their shot, and then it's they're put back on a wait list. The other side is, who knows? We haven't been able to travel for a year. We don't know if certain other countries may say you need proof of a COVID vaccine to get in. Mm-hmm. That could happen. No one knows that. But just like some of the other vaccines, you need to show that you have a measles vaccine or a yellow fever vaccine or whatever it is. You might have restrictions on where you end up going and what to do if you don't have a vaccine. Not a reason, it just, as long as everyone's aware of all the potential, and that's where that communication's key.
That's really good context, Dr. Zehr, because anyone who travels overseas knows you have to produce those vaccination records. So it may not be different with COVID. Do any of you have a comment on Claire's question? Are there some people who should not get the vaccine?
The CDC came out with a pretty strong statement not too long ago. I'm trying to, I should have looked at it before this, but we can all look at it separately. There really are not very many categories of people where it's not recommended. At first, my patients with anaphylactic reactions to one thing or another, or there was a question, I think just directed at me personally, about what if you have penicillin allergy? There's no contraindication to getting vaccine, even if you have an anaphylactic reaction to something else, because this is a vaccine very, very specific to a single protein on the COVID virus. So it's not going to cross-react like it was penicillin or something. We do hear about these allergic reactions occasionally on the news. Any medical therapy, Tylenol, ibuprofen, COVID-19 vaccine has some risks or side effects that are possible, but the numbers are pretty impressive. If we've had, last I heard, it was something like 25 significant anaphylactic reaction after COVID-19 vaccine, 25 people out of 2 million. I mean, there's like that 2 million that have been administered at that date. And there's 100,000 people that are part of the trials at this point or more. So allergic reaction is not a huge concern. And I'm not aware of anybody who shouldn't get the vaccine unless they had a bad reaction to the first one.
Katie, it looked like you were about to speak. No? Okay. Good. Because the next, somebody asked me privately if I've known of any bad reactions to vaccines, and you already answered that question. There's really no known data yet. And just like all of us, the one medication I had a reaction to, now I know I'm allergic because I had a reaction, but it's really hard to tell that in advance.
I think one thing to point out with the vaccine is there is a website that whoever gets the vaccine can log in and record any reaction that they have, from just a sore arm to anything. And that's a really clear way how they're trying to collect data in real time for everyone who gets it, to look for those things and see if there's any correlation with everything. So as we're learning, it's important to be part of that to be part of that and give your information if you have something to share.
That's just how we all participate in the growth of medical science, right? we all share information. I'm a big fan of that. Well, good. I don't have any other questions in the chat. Annika, has anyone raised their hand from your perspective?
I saw that Jane had raised her hand earlier. Do you still have a question?
No, I was just putting a thumbs up to say thank you very much. It's very much appreciated.
Good. Well, I'd like to invite our three panelists to just close by giving kind of a summary of your advice to all of us. And if you would like to share any contact information or even just a website that you'd like to direct people to, I would love for you to be able to get the benefit out of this connection with the community that serves you as well. We'll just start from the beginning. Dr. Norris, any final words?
I think we all just want to represent to the community that, we appreciate how difficult it's been for everyone, for business, for personal and familial situations. It's just been really rough. But I agree with what Dr. Zehr said. Everybody's just working very hard to hold things together. I think if we can all just stand shoulder to shoulder and keep lines of communication open and work together, that we can look forward to a brighter future. And I did just look up if there are contraindications to getting the COVID-19 vaccine. And, all they can say is if you had a bad reaction to the first dose, for heaven's sakes, don't get a second dose. There is the PEG ingredient that's in the mRNA vaccine. So they say if you're allergic to PEG, polyethylene glycol, don't get the vaccine. But I don't know anybody who knows if they're allergic to polyethylene glycol. I think it's very, very rare. So that's the word from the CDC.
Good, thank you. Katie?
Yeah, so I think I just would say, keep up the work that we've been doing, wear masks, try to avoid gatherings with people outside your own household as much as possible. Social distance, all of those things that we've been doing this whole time. And if you're willing, get the vaccine when it comes your turn, and this will turn around eventually. We just have to keep being patient, even though it feels like it's been forever and there's a lot of frustration there, but it's going to get better. We will come out of this on the other side. And yeah, and if you have questions and uncertainties about whether you should get the vaccine or not, you know, reach out to your healthcare provider, because all of us in Estes Park are happy to take questions and, you know, just to help people feel more assurance that they're doing the right thing. So.
Thank you. Appreciate it. Thanks for coming on, Katie. Dr. Zehr, last words?
Yeah, I mean, I would just echo everything that's been said, but as a healthcare provider right now, I think it's really important that the community's done really well. I feel like all the healthcare providers in town are working together. We're trying to help you. We're trying to offer services for everything that you need. Once we have a vaccine in town, trust me, that word will get out in a way, and we will try to manage it in a way for everyone to be able to appropriately sign up and register and do whatever it is to need. That's the ultimate goal. But until then, please keep searching for those other ways. If you really want the vaccine, sign up through the county, you know, get on the list and kind of work the system that way. It's important that we all are working how we can. So those of you who can drive down to Loveland or Fort Collins and get a vaccine, do so. And then that way, those who can't will help you when we are able to get it here. So that's the ultimate goal. We want to continue to care for you, and we're be very excited when we can actually see people's smiles again.
I agree. Well, thankfully, Zoom makes that possible. Thank you both, UCHealth and Estes Park Health, for being members of the chamber. We'll certainly help get that information out. If you have any change in availability, we'll be in touch and make sure that we share that information. I will put a link to the recording and a follow-up email to everyone who registered, as well as links to some of the resources that we've mentioned on this call. So I want to thank everybody for being part of this conversation, and especially it's a great gift that you three have carved out this little bit more than an hour to share and relieve some of the stress that builds up when we don't know the answers to things. And I hope we can all learn how to live a little bit with more comfort in uncertainty, because it's just inevitable, especially in a pandemic. Thank you all, and thank you to all of our participants for coming onto this call. See you next time.